Talk about something else we need to know about. Monica Richards is here. Monica is an RN. She's Director of Regional Operations for Vidant Cardiology. And Monica, it's nice to see you. Merry Christmas.
Merry
Happy
Christmas.
holidays. How are you?
I'm great. How are you?
Good to see you. Now, heart failure is not something we really like to think about, but we better, right?
That's right.
Heart failure is a real thing, and it's especially a real thing here in Eastern North Carolina, and that's what you're here to talk about this morning. The Vidant Heart Failure Clinic opened up in November, and we now have new resources here in Eastern North Carolina for heart failure, and that's what we're going to talk about. Tell us about the new Heart Failure Center.
So the new Heart Failure Clinic opened up on November 4th of this year. Heart Failure Clinic actually started back in 2011, and it's just transitioned over the years, and we recently just opened this clinic. It's located in the Stantonsburg Road in the Stanton Square Shopping Center.
Which people know as the Food Lion CPW Shopping
That's
Center.
right. That's right. It's right beside Food Line. It's in the Cardiopulmonary Rehab building as
Used
well.
to be Pulse, as I recall.
Yeah.
If that's the old timers will remember it as Pulse.
That's right. Back
Yeah.
in the day.
Yeah.
So we are very busy. We have 4 providers there, 2 advanced heart failure specialists, Dr. Al Husani, Dr. Courtney Saunders, along with 2 nurse practitioners and a PA. We also provide resources with the cardiac psychologist for those patients who are dealing with heart failure, who experience a lot of anxiety and depression because of the way their life has changed. We have a social worker to help the patients who are not able to afford their medications, also don't have transportation to their appointments. So we have the social worker involved helping them get these transportation to their visits. We have a nutritionist, because as you might know, patients with heart failure usually have hypertension, have a lot of lower extremity edema, a lot of swelling, have shortness of breath. So they especially need to work with their diet to cut out on the salt, stay away from the Bojangles chicken, all those fatty foods.
Mm-hmm.
And then we have access to lots of materials for education with the patients, and also our care coordination team that's also affiliated with Vidant and the patients in the hospital that help them with dealing with the palliative care piece and
Right.
end-of-life directives and that sort of thing. So,
Well, when you hear the term heart failure, people think heart attack, but it's more than that, right? How do you describe heart failure?
So basically what heart failure is the heart muscle has been damaged, whether by a heart attack, cardiomyopathy, but it's not pumping as well as it used to.
Right.
And as a result of that, the blood cannot fill, so it does not get blood out to the body's organs. So then it makes you have symptoms of increased shortness of breath, fatigue, abdominal and lower extremity edema, swelling, which ends up making you either call the doctor because you're so short of breath you can't walk from here to the mailbox or even to the kitchen without being breathless, or you present to the emergency department with these symptoms.
So we often hear this area of North Carolina described as the stroke belt, the heart attack belt, which of course that's not something we want to be. We'd love to change that, but what are tips? What can you tell us this morning to help us prevent heart failure? We're going into the time of year where overeating and lack of exercise is probably we're at more risk this time of year than any other time.
That's right. And diet is a big thing. Avoiding salt in the diet, watching what you eat, especially for those patients that are already overweight. Increased weight gain makes the breathing even worse, puts more stress on the heart, so it cuts up as well. The other thing is patients that are already diagnosed with hypertension, and if it's poorly controlled, they need to make sure they take their medications. And even those patients that are already been diagnosed with heart failure, even though they feel well, sometimes because of low income, can't really afford their medications, they'll cut back on their medications because they're trying to save it because they feel good today, but that's the wrong thing to do because that's just going to make things worse.
Yeah. Monica Richards, who is the Director of the Regional Operations for Vidant Cardiology, our guest this morning. Again, we're talking about the new addition to the Vidant list of many resources, the new Vidant Heart Failure Clinic, which just opened on Stantonsburg Road in Greenville. How do you get referred there? Do you have to have a cardiologist refer you, or your family doctor? How do you become a patient and be able to use this new facility?
Well, there's probably 2 or 3 different ways. The main way would be your primary care doctor would refer you when they realize that your symptoms are getting worse with shortness of breath, and they'll do a test called maybe an echo, which you get sent to the cardiologist for that. Will show you reduced heart function, and then that's when they'll send you to the heart failure specialist. A lot of patients just show up in the emergency room with shortness of breath and edema, swelling in their legs and the abdomen, and then they'll get admitted. So they'll see the heart failure physicians and consult in the hospital, and then they'll get referred out to the clinic for further follow-up care.
So are the physicians in the heart failure clinic on a daily basis now?
Yes, sir, they are.
Wow. Is that where your office is now?
So my office is actually on W.H. Smith Boulevard, but the heart failure clinic, I'm over that clinic as well. So I go over there, weekly, multiple times a week, checking on things, making sure everything's running like it should.
Sounds like you got a lot on your plate,
Yes, sir.
a lot of responsibility. What a great thing to have in our community, a heart failure clinic. Not many communities have that kind of a facility. Why, give us the importance, talk about the importance of having something like this, particularly with regard to what we talk about with so much heart disease in Eastern Carolina.
Well, these patients are followed closely, especially the ones that are progressing towards advanced heart failure. But the other thing is that they have access to the staff. If they have any problems, they know they can call us. And if they continue to come in and visits and do their visits like they should, then that will keep them out of the hospital. And that's the goal, is to treat them here in our clinic. And we actually can give IV Lasix and fluids like that to keep them from having to go in the hospital, just to keep them from having to incur another expense. One of the other things that we're doing is, expanding our heart failure clinics out into the region. We also have a clinic in the Tarboro Clinic in Tarboro, and we have one in Ahoskie at the clinic there. We have a heart failure clinic there.
I was going to ask you about that. Our listening area covers a wide area all the way from Ahoskie all the way down to Wilmington now. So if someone's listening and they think, man, I could really utilize, I would really like to be a patient and be able to use the resources at the new heart failure clinic. What do? Talk to their family doc or talk to their cardiologist about getting in?
That's right.
Yeah.
That's right.
Okay.
And usually I would hope that these patients would be referred there, by their primary care and their cardiologist.
Right. Okay. All right. It's the new heart failure clinic, Vidant Heart Failure Clinic, which is opened up 2470 Stantonsburg Road, right near the Food Line CPW Shopping Center. Anything else that that I didn't ask you that you want to mention about it, or anything else going on?
No, sir. I think that's pretty much covered it.
Well, listen, thanks for coming in. Great to see you. Thanks to our guys at Vidant, Brian Woodkowicz and Jason Lowry, who's here in the studio with us this morning, always keeping us informed of the great things that happen at Vidant Health, because, man, are we lucky to have it,
Yes, we are.
It's really something that we've got such an unbelievable healthcare community here in Eastern North Carolina, and we're so proud of it. Thank you. Nice to meet you this morning.
Nice to meet you, and thank you very much for inviting me.
Absolutely. Monica Richards, the Director of Regional Operations for Vidant Cardiology. All right, let's take a break. When we come back, as we promised, we're going to talk about the Edenton Christmas Candlelight Tour, which is coming up tomorrow and Saturday in my home county in Edenton, North Carolina. And if you've never been, I was in Edenton last week, and I just drove around a little bit and looked at the decorations. You ever been to Edenton? Isn't it beautiful?
It is.
It is one of the coolest little towns in the country. And this weekend will be the weekend. If you've got nothing going on, stand by. I got some free tickets that Mike's going to let me give away, but we'll talk about Christmas in Edenton this weekend, the Christmas Candlelight Tour coming up this weekend. We'll talk about that right after this. Stay with us.